Colleagues, I've spent my life dedicated to providing Medicaid services here in Oregon and to low-income people around the world. Why would somebody in my position stand up today and have concern that could affect the health care of children? I am concerned about the health care of children. I've shown that in my personal life. I've shown it here, and I've shown it on the floor. I sponsored a bill, 3431, that I believe if it would have had a hearing, could have gotten to this result with a different funding mechanism. That bill didn't even get a hearing. I worked for over a month on that bill with Legislative Counsel, Chair Greenlick, and Vice Chair Nose. It was pulled from the agenda. Colleagues, I worked a long time with Elisa Kennedy-Geyer on federally qualified health centers for what we call the COWM population. These are the women that don't qualify for Medicaid under the standard population or expanded population because of their citizenships, yet they qualify through a federally funded program because they're pregnant. Under the federally qualified health center, these pregnant women were able to access, 60% of them were able to access health care services. The pregnant women on Medicaid, the citizens of Oregon, according to the OHA's own numbers, which took me over a year to get out of them, only 9% access in 1 year and 18% access in another year on our fee-for-service system. We are potentially talking about taking children that are currently qualified under the federally qualified health care system and putting them in a fee-for-service, potentially fee-for-service, potentially CCO. The bill doesn't spell it out, but taking them from the primary care that they already fully fund under the federal system and putting them into a system that has been proven to show limited or no access, particularly to oral health care. I am worried, standing here today, about the effects of what we're doing, not just the agenda behind it to say we're going to cover all kids. It is one thing to say we're going to cover all kids and hand somebody a piece of paper that says you have an insurance paper that says you have coverage. It is a far different thing to hand that to the mother of a child and say you have a clinic to go to and seek access. Our federally qualified system is currently set up to take care of these children, and they're doing a far better job than we are doing in Medicaid in Oregon. I fear for these children that OHA will not be able to handle the IT problems that they've had, handle the enrollment problems, and cause our children to lose coverage. I stand here today because I don't want to cause problems with our current Medicaid system as it supports, and our federal system as it supports, as it was written under President Obama. Now we have a different system, and we are by changing the avenues of funding and taking money that could have otherwise been matched with the federal government, taking it out of that system, putting our own citizens at risk while putting these non-citizens at risk from accessing the federally qualified health centers. Federal government, we don't know that we will guarantee to continue to have that if Oregon goes down this route. There are 50 federally qualified health centers with 150 partners through citizen participation and nonprofits that provide services to these children currently. Over 200 clinics in Oregon provide these services, these primary care services currently. And I note the VA only has 5 clinics.